This is Tanya Stansel, and we'll be discussing uterine fibroids. Please click like and subscribe below. Disclaimer, this video is for educational purposes only. It is not to diagnose or treat any condition. Uterine fibroids are non-cancerous growths within the uterus. They do not increase the risk of uterine cancer later in life. They can range in size from undetectable by the naked eye to large enough to distort the uterus. Someone may have only one fibroid or multiple fibroids. They can occur in different layers of the uterus, including the endometrium, which is the inner layer, the myometrium, which is the middle layer, or the periometrium, which is the outer layer. Other names for fibroids include leiomyoma, myoma, uterine myoma, and fibroma. There are several risk factors of uterine fibroids. The first is age. Fibroids most commonly occur between the ages of 31 to 40, but they can occur at any age. Family history. If your mother had fibroids, you have a 3 times greater chance of having fibroids. Race. Fibroids are most common in women of African descent than in whites. Obesity. There is a greater risk of fibroids with obesity. Eating habits. A diet with a lot of red meat, ham, and alcohol increases risk of fibroids. Diets with green vegetables are protective. A woman may not have any symptoms of fibroids. However, symptoms include heavy bleeding between and during menses, blood clots, pelvic pain, low back pain, increased abdominal cramping with menses, increased urination, pain during intercourse, longer menses, abdominal pressure, abdominal swelling, anemia, constipation, rectal pain, infertility, and complications during pregnancy and labor. Imaging tests that can be used to help diagnose uterine fibroids are ultrasound, magnetic resonance imaging, or MRI, X-ray, hysterosalpingogram, which is where X-ray dye is inserted into the uterus while X-rays are made, sonohysterogram, where water is injected into the uterus while ultrasound pictures are taken, hysteroscopy, where a scope is placed inside the uterus, and pelvic MRI. Some things to consider when deciding on treatment are whether you are having symptoms, if you want to become pregnant, the location and size of fibroids, age at the time of treatment, and the length of time until menopause. Some medications that can be used to help treat uterine fibroids are ibuprofen and Tylenol for pain, iron for anemia, low-dose birth control pills, progesterone-like injections such as Depo-Provera, and the Mirena IUD to help control bleeding, and GnRHA, or gonadotropin, releasing progesterone agonists, which help to shrink fibroids. Surgical options are myomectomy, where fibroids are removed through laparoscopic, hysteroscopic, or open abdominal surgery, hysterectomy, where the uterus is removed, hysteroscopy, where fibroids are destroyed through electricity or laser, uterine artery embolization, where particles are injected into arteries leading to the uterus, which cut off blood flow to fibroids and they shrink, and magnetic resonance imaging guided ultrasound surgery, where the MRI directs where to use the ultrasound to destroy fibroids. Thank you for watching our video today. Please click like and subscribe below.